Kenya is located in eastern Africa against the Indian Ocean. It borders Ethiopia, Somalia, Tanzania, Uganda, and Sudan. Although Kenya is a magnificent country, they do face their share of difficulties and major problems. Their four biggest problems include education, unemployment, HIV/AIDS, and water and land. We believe that with a total budget of $10 million, we will be able to help out Kenya in the areas where they need it the most. HIV/AIDS is a growing epidemic around the world, but especially in countries located in sub-Saharan Africa, like Kenya, which accounts for 60% of the world's cases. Kenya, said to be home to one of the world's harshest HIV and AIDS epidemics, especially needs our help the most. We believe that with a budget of $2 billion, we would be able to curtail HIV and AIDS in Kenya. We would be able to do this by providing formula to new mothers. This eliminates HIV/AIDS through breastfeeding, also known as mother-to-child transmission. Between 1.1 and 1.7 million infants are infected through the disease through breastfeeding, and if we are able to provide formula, the children wouldn't be able to retract the disease from their mothers. Providing free antiretroviral drugs. Kenya has been doing a program like this since 2006, but this program has limitations on who can receive the medicine. We want to make it able so that everyone who needs the drug can have so for free. Also, pharmaceutical companies in Kenya are now allowed to produce a generic form of the drug, and by funding them further, we will be able to save the country enormous amounts of money as well as patients. Provide HIV education in schools. We want to educate students about the disease, how it's caused, how to prevent it, etc. By knowing more about the disease, they will know how to better protect themselves against it. We also want to educate them on where they are able to get tested if they have the disease, also whom they can talk to if they think that they are in this situation.
Even though schools in Kenya are generally very effective and are taught at a high level, there are some major problems that we believe we can improve with our budget of $3 billion. Three major issues are the expenses required of the parents, the distance between the location of the homes and the schools, and the lack of teachers. We believe we can solve these problems through building more schools and changing the standards for the schools. Building more schools will allow more teachers to be hired, more jobs to be created, class sizes to decrease, and the schools to be closer to the students. Raising the standards for the schools will allow for the gap between public and private schools to decrease, which will shrink the socioeconomic gap in the future. Unemployment also poses a great problem because of the amount of adolescents that are unemployed. This implies that the younger generation is not working and thus not improving lifestyles for their future families and the future of their country. Poor health also contributes to the shortage of workers. We believe that providing vocational training, we will be able to train workers in a field which will actually be relevant to the jobs available and provide employment for many years. We also want to provide incentives to have children attend schools. Some of these incentives can be money for the parents, reduction in the school fees, and medical care for the students. These will only be given if the requirements are met. These are large incentives that can help families and also break the cycle of lack of education in the future.
Kenya is divided into 5 drainage basins. They are the Lake Victoria, Lake Baringo, Lake Turkana, Lake Naivasha, and the Kerio River. Water supply and sanitation in Kenya is characterized by an inconsistent supply of water and low access of water in rural areas and urban slums such as Kibera. Scarcity in Kenya has been an issue for decades, as only a small percentage of the country is optimal for agriculture, and the year-round climate is predominantly arid. Kenya's natural water resources also do not provide an equitable delivery of water to the various regions of the country, and the country's water basins do not reach an even-handed area of the country. This leaves most of the population without any fresh water. Rapid urbanization has also pushed poor urban dwellers to the slums where there is no water or sanitation. Overcrowding exacerbates the already hazardous health conditions. A budget of $4 billion will provide ways to channel clean water to those areas that are lacking by building wells and dams to provide safe, accessible water for daily life and in times of drought. Another solution to water scarcity is the use of desalination technology. This is a process of filtering salty water to provide fresh water. To address the sanitation of water, educating people on the dangers of water pollution to their health and that of their livestock and crops will encourage them to implement safe water usage and increase health. A huge water source has been discovered in the arid Turkana region of northern Kenya, which could supply the country for 70 years. Opens a door to irrigation and industry benefits. This would also be beneficial to the people of the Turkana region who have always been water insecure.
The rapid population growth of Kenya is also a pressing issue. With a youth dependency ratio of over 76% and over 42% of their population being 14 years or younger, Kenya is undergoing a population boom. We believe that with $1 million, we can address this issue by providing education on birth control and contraceptives. Not only do birth control methods like condoms help lower the high birth rate, but also help prevent the spread of HIV and AIDS and other sexually transmitted diseases. In addition, we recommend educational seminars on family planning for both young adults and adolescents to help lower the birth rate. We also advocate for the legalization of abortion and proper training of abortion clinic staff. Over 700 illegal abortions are performed daily in Kenya, and abortions are one of the leading causes of maternal death and injury. By pushing for the decriminalization of abortion, safe and affordable abortion options will become available to women.